start, so we can just start when we're ready. And I can cut that off. Okay. No slouchy shoulders, right?
Yeah.
Back a little bit.
Hi everyone, I'm Jacinda. I'm a wellness coach at JacindaWilhelmina.com, and today I've got the pleasure of interviewing a good friend of mine, Gilly Davy.
Hi.
Hi Jill, how are you?
Good, thank you. Thank you for having me.
Pleasure. Now, tell me, you're a physio.
Yep.
Tell me why physio? What brought you into physiotherapy?
A very long story. I got into physio from actually wanting to be an animal physio to start with. Grew up on a farm, loved horses, and was once told about an animal physio, and I thought that sounds just like me. And then interestingly, through my career of becoming a human physio and being educated and going into the workforce in the UK and the National Health Service, realised I actually really like treating humans. So they tend to talk a little bit more and respond a bit better. So that kind of drove me into physio. I'm in a fantastic situation that I do really love what I do. I've done a range of physio. I've senior level at respiratory, sports and neuro, and it's been the last 6 years that I've really specialised in neurophysio.
Okay, so I'd love to know what exactly is neuro for those out there that don't know what physiotherapy is.
And it's a common question because most people think, physio, it's that sports, running onto the side of a pitch, help yourself. So neurological physio is a whole part of physiotherapy itself, and it's essentially working with people that have had some form of effect on their brain or their nervous system. Okay, so that if you look in the brain, we're looking at people that have had strokes, head injuries, brain tumours. We're looking at spinal cord patients, MS, Parkinson's, right down to sort of peripheral neuropathies from diabetes. So it's very wide. Essentially what I do is basically try and rehab the brain and the body back together. Depending on the condition, will depend on where the rehab goes. With everyone, we're basically trying to get as much quality of life as we possibly can, and really optimise their, where they want to be. So someone who's had a stroke, it might be getting them back up and walking again, and really, really pushing on the intensity side. Someone with a much more progressive condition, something like motor neuron disease, then our approach is much more conservative, but what we're looking at there is lots of therapy aids, getting house equipment in, power wheelchairs, and really still making sure they've got the optimal quality of life and adjusting there. So it's a wide region of talking, and educating even within neuro itself.
And it sounds very special. So it's very specialised and individualised to the condition, and all about basically empowering them to back to independence and quality of life.
Yeah, definitely.
And so, is there a reason why you've decided? It sounds like you've branded out into starting your own business, which is Connect Neuro Physiotherapy. Physiotherapy.
Yeah,
sorry.
That's all right.
I'm an exercise physiologist, so that rolls off the tongue. And so, what is it? What's your passion around wanting to branch off? The
reason why I set this, so it's an online neurological consultations, is that where I've worked around the world and travelled, is that there's a real disparity in health. That there's a massive gap. That if you don't live in one of the major cities, then how do you access someone who has got the top level experience working with the most up-to-date evidence-based practice? If you live out in the country or in a country that, is not up in the first world, development regarding medicine, and I feel that the world has got smaller through the internet, and accessing things is easier, that everyone has, the right to access high-level quality medical advice. And a lot of what I do is about giving people the knowledge. If you've got knowledge about what is the best thing to be doing for your Parkinson's disease to optimise your quality of life, a lot of that can be done, through, communication. So it's kind of a video conferencing that I do. It's never going to replace hands-on physio. There's always going to be a need for hands-on physio, and I will definitely be referring people on. But so much can be done just through that increased knowledge and just increased access to it. So.
Okay. And how would this work? So if someone wanted to work with you, how would they go about that?
So you can find me at connectneurophysiotherapy.com, big long word. But on there is lots of information there about the online consultations, but essentially there's a contact us form there, so give us an email, and we set up the first initial consultation via video. I'll get you to fill out a kind of pre-admission form, so I've got a bit of background about, you know, where you are, what you want to be going towards, what's your condition. And then from that initial consultation, obviously everyone's highly individual, that, you know, it might be that it's a one-off, give you a bit of direction, you know, this is where you're at, these are the things you should be incorporating in your life, and it might be catch up once a year, compared to someone that really does actually need an exercise program, and then that can be delivered through a 3-month or a 6-month basis through there as well.
Great, sounds really comprehensive.
Excellent.
Sounds awesome. Gilly, so one fun thing, something that we'd love to know about you.
When I'm not being a fabulous physio, I do a lot of competitive trail running. So love being out in the countryside, getting covered in mud, charging up and down trails, and do that fairly competitively. So that definitely keeps me tired out.
Sure does. Well, thanks so much for your time, Jill. It was awesome to chat with you today.
Thank you.
And if anyone would like to find Jill, you can find her at www.connectneurophysiotherapy.com.
Excellent. Thank you very much.